Assalamualaikum friends, I am Wasila Khaskeli, student of first year DVM at Sindh Agriculture University, Tundu.
Today, I am going to explain the distal extremity of humerus in the horse. The distal extremity means distal means away from the body. This is the lower end of humerus bone, as you can see, and it plays an important role in forming the elbow joint. It articulates mainly with the radius and ulna at this olecranon and radial fossa, and it helps in movement of the forelimb. Here we can see the condyle of the humerus. This part articulates with the radius and is very important for the movement of elbow joint. It mainly allows flexion and extension. As you can see, its one side is large, one condyle is large, and other condyle is slightly small. The condyle that is large is called medial epicondyle, and the condyle that is slightly small is called lateral epicondyle. Now, as we can see that the structure here, trochlea of condyle. Medial epicondyle is also called trochlea and lateral epicondyle is called capitulum. This point is very important for the perspective of exams. Then we can see that trochlea is especially adapted for hing movement. It gives hing movement and it ensures smooth bending and straightening of the limb. Now we can see that here are two fossas. One fossa is called olecranon fossa and other fossa is called radial fossa. Olecranon fossa is present in the caudal side and it is more deep than radial fossa. So the question is that how we will differentiate and how we will know that which fossa is olecranon fossa and which fossa is radial fossa.
So the fossa that is deep is called olecranon fossa and the fossa that is shallow is called radial fossa.
The olecranon fossa is present on the caudal side of humerus. It receives the olecranon of the ulna during extension of elbow. So you can see that it receives the olecranon of ulna during the extension of one elbow. And the other side is called radial fossa. We can see here it is present on the cranial side. It receives the radius during flexion of the elbow. So you know that olecranon fossa receives the ulna during extension of elbow and the radial fossa receives the flexion, receives the radius during the flexion of the elbow. Olecranon fossa is used for extension and radial fossa is used for flexion. Now we will see that here are epicondyles. There are two epicondyles, lateral epicondyle and medial epicondyles. These are rough projections that serve as attachment points for muscle. The medial epicondyle gives attachment to flexor muscles while the lateral epicondyle gives attachment to extensor muscles. Again, I am repeating that medial epicondyle gives attachment to flexor muscle and lateral epicondyle gives attachment to extensor muscles. These are rough projection you can see on both sides of the humerus. To summarize, we knew that condyle articulate with radius, trochlea is on medial side, medial condyle, and capitulum is on lateral side. Olecranon fossa is used for extension and radial fossa is used for flexion. Epicondyles are used for muscle attachment. These structures are very important for the proper functioning of the elbow joint and are asked commonly in exams and viva. Thank you.